Next. There is this so-called special precautions. Okay? If and ever you will give a product, our product, with resveratrol, especially Restorlife. The word is especially Restorlife. Okay? So what are these so-called special precautions? During pregnancy, if that female is a lactating mother, breastfeeding, for those taking blood thinning medicines, and what are these medicines, people? Let me try to mention some of these medicines. Aspirin, heparin, warfarin, coumadin, and of course, one of the most famous will be clopidogrel. And the last is still under delay, but that is the cancer of the female reproductive organs. Why? Because of its so-called phytoestrogenic effect. Okay? Next. I'll go back to that. Those just later. Okay. If you will give Colidus, please, you have to monitor first for the blood cholesterol of your client. If his or her cholesterol count happens to be more than 150 milligrams per deciliter, you're only going to give once a day of Colidus. If that will be more than 200, make it twice a day. And for more than 250, that will be 3 times a day. I'm sorry. But this one should be taken during mealtime. For perfect white, you can either start with once or twice a day, or if you would like to maximize the effect of perfect white, 4 tablets per day. What else? White light. Give it 3 puffs or 3 sprays every 4 hours, 4 times a day, for approximately 12 puffs per day. I'll try to insert slimitrim here. I'll make it simple for you. If we're going to give slimitrim, okay, guys, for a 5-footer female, you're only supposed to weigh approximately 100 pounds. For the males, the baseline weight should be 106 pounds. Now, for every inch that you will add to your height, you will add 5 pounds for the female and plus 6 pounds for the male. Still, I'm going to explain this later to you. Okay. And guys, a good example will be if you happen to be a 5-footer female, you should weigh approximately around 100 pounds. I'm sorry, but we need to use this lower portion of the whiteboard. Ideal body weight. minus or plus 10%. Overweight. Divided into 2. 11 to 15%. 16 to 20%. And finally, the obese type. More than 20%. I'll go with those so-called competitions later. So people, I'd like to ask you to bring down your pens for me to be able to explain this. Okay? And don't worry, I'm not going to erase it. You can take those so-called pictures later. So let's start. Again, if your client will happen to take our products or herbal products for the first time, please start with once a day. Okay? Just add 1 capsule every week until you reach 3 times a day. Okay? 30 minutes before meal or 2 hours after meal. Why? For better absorption of the product. Again, why? For better absorption of the product. Next. This will be as a maintenance. There is this so-called old saying that prevention is better than cure. If your lifestyle is said to be so busy 3 times a day, but if you have a so-called relaxed lifestyle once a day. Okay? Now, the word again is maintenance. Prevention better than cure. If by chance you're already suffering from different kinds of diseases, hypertension, diabetes, asthma, you can go as much as 2 or 6 capsules per day. And you're only going to give the mega dose for those suffering from cancer. Okay? Now, again, people, for me to be able to clarify this issue, Doc, why do we need to just give 1 capsule of C24/7 or complete on the initial week? Okay? And why not give it at once at 3-3-3 dosage? Or when is the best time to take the product? If I will ask you, please be honest, who amongst you, when you started taking C24/7 or when you took it for the first time, felt so energetic? Can you please raise your hands? Very good. Please be honest, who amongst you, when you initially took the product, C24/7 became a little bit drowsy or sleepy? Yes. And who amongst you were not able to feel anything when you initially took the product? Please be honest. Yes. Why? Because different individuals will react differently to a certain product. That is the main problem of some of the distributors. Why? Because when they promote the product complete or C24/7, what they usually tell is, brother, if you will use this, you will become so energetic. So when the client took the product and became so sleepy, it's not good for my body. Because it's how you present and explain the product. So when are we going to take it? If you will take it and you felt so energetic, take it in the morning. So you will be awake for the entire day. But if you will take it, you will feel so drowsy and sleepy. Please take it before bedtime. So once you feel so sleepy, then sleep by all means. Okay? That is how you take the product, people, until there will come a point in your life where you will be able to adjust with the product that you can take at any time of the day. So on the initial week, please try to follow that simple rule. Now, Doc, so once a day, twice, 3 times a day. But again, you've been taking herbal products on the past, you can go as fast as 3 times a day. Now, you can reach this stage 222 for different kinds of diseases, especially if you will take this product alone. Okay? And again, this is what's being recommended by Dr. Dean Morris. Up to 222. Why did we came up with 333? As I explained to you earlier, still remember the recommended daily allowance, people, or dietary intake? Still remember the topic earlier, guys?
Yes.
That is this. But for those suffering from cancer patients, people, have you seen cancer clients? Yes or no?
Yes.
Are they becoming thinner, people? Are they losing weight?
Yes.
Why? Because the tumor cells are trying to eat the nutrients supposedly are meant for your body. So if that will be the case, guys, we should give the ODI, the optimum daily intake or dietary allowance or dietary intake that your body needs in order to fight what? The cancer cells. That is the only time we're in, we will give 3. But the big question is, are we claiming that we can treat diseases, yes or no? No. Please be careful with what you will tell to your clients, guys. Remember, we're promoting herbal products. What's the word? Food supplements. If you were able to remember our earlier topics about antioxidants, there's so many studies that have shown that if you're going to increase the level of antioxidants, we can be able to recover from different kinds of diseases. Those are according to scientific studies. Why again? Because if you will be able to increase the level of antioxidants, you will be able to increase the function of your immune system. And I can assure you guys, if you will be able to improve the function of your immune system, that's what antibodies, killer cells, will be able to kill microorganisms, including cancer cells in their body. So with that, people, is it good for us to take herbal products, yes or no?
Yes.
Guys, we're here to try to help normalize. The word is trying to help normalize the systems of the body and improve the systems of the body. Are we clear so far, guys?
Yes.
Let's continue, people. So, dosage of complete symptom percentage is the same. Diseases, cancer patients. Rest your life up to 3 times a day if you want. And again, if you would like to give Vida to dilate or open up your blood vessels to improve the flow of blood once a day and to speed up your metabolism twice a day for those especially who would like to lose weight. Now, I would like to repeat this. Special precautions. Can you please say it loud? Special precautions for those taking resveratrol, especially Restore Life. Why? Okay. In order for me to clarify this issue, resveratrol. Okay? What are these products? C24/7, Restore Life, Vida. C24/7, people, it contains 550 milligrams. Restore Life has 325 milligrams, while Vida has 90 milligrams. So, does it mean that Restore Life contains more resveratrol than C24/7? No. Why? Because these C24/7 are being represented by 7 capsules. How's that? Can I borrow a box of C24/7? I'd just like to explain it to you people. Do you have one? Can I borrow a so-called box of C24/7? Ayan naman kita. Thank you very much, Brad. Okay. Who are new members here, people? In front. So, mga matatanda na pala ito. Hindi. Tita, steer to clear eyesight. Can you please read the one below the dark line? Patay, malabo mata nito. Kailan? 550. No, 550, that's clear. Can you please read this one? Serving size. 7 big capsules. So, what does it mean? Okay. Others, when they try to look at these products, especially doctors, if you like explain this, we'll try to tell you that we're giving too much vitamins and minerals to our clients. But people, again, please try to explain that everything within here at the back of the box are being represented by 7 capsules. Are being represented by how much? 7 capsules. The complete product is being represented by 6 capsules. So what does it mean? Thank you very much, Brad. That you need to divide this by 7, which will only give you approximately 78.5 milligrams per capsule of resveratrol in C24/7. Well, when you talk about Restore Life, guys, per capsule kaagad, 325 milligrams. And in Vida, per sachet. So if you would like to get the resveratrol components of Restore Life, you need to take at least 4 capsules of C24/7. Do I set myself clear?
Yes.
Okay, so again, pure resveratrol. Special precautions, pregnancy, breastfeeding, why? Still, if you're going to read on scientific studies, still without any scientific studies that can prove the safety of resveratrol for our pregnant clients, especially for their fetus and for the newly born infants or babies. So if there are no proven scientific studies yet, don't give it yet. Next. Blood thinning medicines, why? Remember, one of the beautiful functions of resveratrol is that it is also a blood thinning product. So if I'm going to give you a medicine whose function is also a blood thinner, then you might push your client to suffer from bleeding. So please try to avoid it. If that client of yours is taking aspirin, heparin, warfarin, Coumadin, on clopidogrel, and this one's still under debate. Cancer of the female reproductive organs. Why again? Paito, estrogenic effect. Who has higher levels of estrogen, males or females? Answer.
Female.
Female. For the males, you have testosterone. If your estrogen level is higher, then I'm afraid. So, testosterone, okay? So estrogen peak, ladies especially, first, the problem is, you might push the female clients to suffer from cancer of their so-called female reproductive organs. That includes the breast, ovary, fallopian tube, uterus, cervix, and even the vagina. So again, if there are conflicting studies, might as well not to give Restore Life for those types of clients. Are we clear so far?
Yes.
I'm more specific on Restore Life. Okay, now, how about for those clients who are suffering from dengue? And we all know the main problem for dengue. One of its complications will be what? Bleeding, because of low platelet count. So again, if I'm going to make you choose amongst the 4 products there, which will you prefer as the safest possible product for dengue clients? Complete. How about for your leukemic clients or anemic clients? They'll also go with complete. Okay? Because of their tendency to suffer from what? Bleeding episodes, people. So we will go with complete for other clients. For the kids, what's the best product for the kids?
Complete.
24/7. For those whose ages 2 to 11 years old. Are you clear so far, people?